during COVID, nobody could go get a lot of the procedures that we perform. So we had this empty surgical center. So we utilized that space. We bought cameras, we bought microphones, and that's where that journey of Advanced Musculoskeletal Ultrasound Center started. If you're going to start a business, I think it's a good idea is to have a business fellowship or a mentor or somebody that really knows what they're doing.
Alex Ramosi says 391% chance that you'll get that lead if you contact within the first minute. You wait 5 minutes, that drops, right? So you get a lead, you're waiting to the next day to call it. The chances of those people answering, they're gone.
One of the reasons that I wanted to come on with this podcast is because I think this is a good avenue to teach people that you're not stuck. You don't have to be burned out. You can do something about it and stay in the medical field. You can do something about it and not have all those stressors that are weighing you down.
Welcome to The Shift, From Limitation to Liberation, the podcast for healthcare providers who want to escape the grind of the W-2 and want to move into owning their own future, passion, and purpose. I'm your host, Dr. Vega, and today I'm joined by Dr. Ryan Martin, physical therapist by trade, educator, content creator, and owner of MSK Ultrasound Center. Did I say that right?
Yeah.
Perfect. So today we're going to deep dive into his journey from graduating physical therapy school, becoming an employee, and those mindset shifts that have to happen in his life to go into owning his own company. So I'm really nice to have you here, Dr. Martin. So go ahead and tell us a little bit about what's going on with you and your past and your journey.
Sure. So, as you said, my doctorate is in physical therapy, but that's not really where it started. It was a long journey to get to where I am today. After I graduated high school, I went straight into undergrad, not knowing what I wanted to be in life. And I think that's pretty consistent with a lot of people out there. And so I actually went to school and I got a degree in psychology, and I also went to school for religion. Now, those within themselves didn't get me too far. So after I graduated, I went back to school and I started biochemistry. And so I went to school in Nevada for biochemistry. I applied to medical school. I was on my way going to medical school, and then decided, that was going to be a journey that I didn't want to take. And so then I applied to PT school. And then when I got into PT school, I did that whole thing. I did all my rotations. And when I got out of PT school, I became a W-2 workhorse, and so I worked in an outpatient setting in Hawaii, and it was just draining. The clinic was great. It was a phenomenal experience, but just, working for somebody else, as you may know, it takes a lot out of you. And so I worked in Hawaii in outpatient for a while. Then I moved to Arizona to take care of my grandfather because he was ill at the time. So I came out to Arizona and I managed, there was a company that had pain management physicians and physical therapy practice combined. And so I became a manager of that. So I was overseeing 8 clinics. And again, still a W-2 employee, just working the grind, just day in, day out, just hiring every day. And so finally, there was this moment of clarity. I've talked about it in other podcasts, and I'll just briefly say it here. There was this moment of clarity when I was in a pain management center, and I was essentially trapped in a room with a 6'6" schizophrenic. And the door was blocked by EMTs because there was somebody having an overdose in the room adjacent to us. So they had to close it off to take care of that patient. So I was stuck in a room with a schizophrenic who was also claustrophobic. And it was one of those defining moments where I said, I gotta get out of this. And so long story short, I met some phenomenal people that worked in the MSK ultrasound side of things. They got me in trainings all over the country. I got to train with some of the best people in the world. And so I started that journey. And so I partnered with another company and I worked in sports medicine. I cut my teeth with orthobiologics early. And then over time, I really saw the light with, I got to stop working for other people. I got to do something for myself. And so at that point, we essentially formulated a group to where we started PT integrated medical practices. So we had medical alongside PT, and then we kind of crossed the gap with imaging. And so we utilized MSK ultrasound as kind of like that bridge between the PTs and the medical. And so we started that company, and it actually our first clinic really opened during COVID, and
Oh, wow.
so it was a tough journey. So I partnered in that, and so we did grow that, and the model is it's still in the works. Like nothing's ever perfect, so we're always trying to work on that. So essentially, after the past couple of years, we've now grown to 8 clinics of integrated practice. So I'm a partner in 8 clinics of integrated practice here in Phoenix, Arizona. But in the time of that, there's a PT MSK specialist by the name of Colin Rigney.
Hmm.
If anybody doesn't know him, look him up on LinkedIn. He's my business partner. We then founded an education process to teach MSK ultrasound to physicians, PTs, PAs, anyone in the allied healthcare community that can sit for MSK ultrasound. So we started that program. It was grassroots, didn't know what we were doing. It was the first time I ever got in front of a camera. We developed an entire education series within a surgical center that was closed because it was elective. And so during COVID, nobody could, go get a lot of the procedures that we perform. So we had this empty surgical center. So we utilized that space. We bought cameras, we bought microphones, and that's where that journey of advanced musculoskeletal ultrasound centers started. Is we really, two knuckleheads with a camera and decided, hey, let's make something out of this. And that's where that was born. We had a PNMR physician that helped us with all the injections. And so we just developed that whole case. Now, you talk about what, 6, 7 years later, now we've developed a residency program to where we have physicians and clinicians from all over the country that come shadow us and learn from us from our online stuff. So we really built that, over time. And I think the journey now is at the point to where we're trying to develop better resources for clinicians out there to do a better work into integrating imaging and orthobiologics into practice. So that's really my quick synopsis of my journey.
That's awesome. And it's crazy how, you think about COVID, and COVID is either you created something, or a lot of people just ended up not having a career, right? And it's crazy how, when you think about it, and I know a lot of content, and we can get into that later, but content creation, I think when COVID, when everything shut down, I think a lot of people that were in content creation got really, really big, right? Because again, there was nothing else to do. But then you think about other industries that literally crashed. So it's crazy because you have both extremes during COVID, and with you, it gave you the time and the place and everything to start what you're doing right now. Is really cool. And you know that, I think, dude, because I was, my background, I was a physical therapist. I was a physical therapist, again, like you. I did pre-med. I went to University of Florida. I did pre-med. At that point, I was like a gym rat. I still work out all the time, but I'm like, listen, I don't want to go to medical school and spend 4 years of medical school and then residency. I'm not gonna have time to work out. Love the health field. So I'm like, hey, I did exercise physiology. Then I'm like, I want to apply, take my GREs, and I went to FIU Miami, became a therapist. But I always wanted to go to medical school, so that never went away. So I was a therapist for 8 years. I'm like, I'm crazy at 32 years old. I'm like, hey, I'm just gonna go back. I'm just gonna do it. And I did, right? So, but I understand that because I did my master's in physical therapy and I went to medical school, and I know that there's no comparison in the amount of anatomy that you get between medical school and physical therapy school. But physical therapy school, is 3 years of like, hey, you're learning every single muscle. Intervention, insertions, origins, how to train it, how to therapy. So I think the combination of ultrasound to that background is excellent because, again, I can speak because, again, I did both, right? I did, after medical school, I thought I wanted to be a surgeon. I did a year of general surgery, and I'm like, no, this is not for me. So I switched specialties, did family medicine 3 years, and then I did a year of sports medicine fellowship, mostly because of the MSK ultrasound curriculum, which is part of the fellowship training in sports medicine. But I understand that you don't get that quality of like MSK study in medical school or even in family medicine residency, because again, it's all about pharmacology, biochemistry, pathology and all that stuff. And but adding, I think, the ultrasound to somebody that knows so much knowledge of MSK, I think is like a great combination, right? So now being able to teach other doctors, because with regenerative medicine, now everybody's doing it, right? So you have all these internal medicine doctors, family medicine doctors, no MSK training, and they're trying to do all these injections. And you know that if you don't know sono anatomy, if you cannot like see the part that you're injecting, you're not going to get results. Patients going to be wasting their money, right?
Absolutely. I mean, that's the foundation of what we teach.
Yeah. No, that's awesome. That's awesome. So again, now, so if we go into the business, like what's your business model? How do you? One thing that I like to tell people is because making that transition, making that shift too, from working a W-2 for health insurance like I do to owning your own practice, you don't learn anything about business or marketing or sales on physical therapy school or medical, any type of professional school, right? Now you want to transition into owning a business, even though it's in healthcare, it's still a business, right? You don't have an insurance company feeding you patients. Now you're out there to fend for yourself, right? So you have to learn how to first of all, you have to learn what a lead is, right? You don't know what a lead is in medical school, right? I mean, an EKG lead, right? You don't know what an actual lead is, right? So how do you get leads? How do you nurture these leads, right? So you want to we'll talk a little bit about that.
Sure, absolutely. Well, going from W-2 and the business is done for you, somebody's in the background taking care of everything for you. And then when you make that transition, it's like you're on an island. You really don't know what you're doing. You really, you rely on, friends or other people or other models, and you try and learn it from scratch. And so that's what we did, is we really built the business model not knowing what we were doing. We had a business partner. He's a physical therapist, but he has an MBA. And so he helped us along the way, kind of figuring out how to get things working, how to move, how to, transition. But ultimately, after the 6, 7 years of a trial and error, trying to get, people to come into our education program, things like that, we finally decided to get into a business fellowship. And so, yeah, so Colin and myself got into a business fellowship, which really changed the game for us. It really taught us what a lead was. It really
Yeah.
taught us how to formulate, our business strategy, how to create SOPs if people don't know what that is, right? And so we built this all, and we didn't have a bad start. It's just we didn't really have a direction on where to take it from a business side. And so and in my opinion, if you're going to start a business, I think it's a good idea is to have a business fellowship or a mentor or somebody that really knows what they're doing. And so I would say for us, learning the ropes of business was really gained by joining a business fellowship.
Yeah, no, I completely understand. I mean, I do belong to a a mentorship also, and like my mentor says, he's like, listen, you are there's an ignorance tax that you're gonna have to pay, right? You either pay with time, right, or you pay by paying somebody that can condense 20 years of experience into a couple of weeks, right? So you know exactly where to go, right? They already made the mistakes, right? I heard something once say, a smart person makes a mistake once and learns from it. It was like a dumb person keeps making the same mistake over and over, and a really intelligent person learns from other people's mistakes and never do them in the first place, right? Having that guidance, that mentorship, hey, this is what you want to do, and mostly, healthcare workers, right? And that you have no idea of business, right? This is a whole different, it's like a whole different world, right? But yeah, I think coaching and mentorship is a must, like you said. I think that's very, very important, um, to save years of headaches, right?
Well, I mean, you say you kind of pay it in two ways, from time, or from, paying somebody. I think, from us putting all the time in, we learned a lot, but we also built bad habits, by not knowing, better strategies. And so, unfortunately, even having a business fellowship is we had to reprogram ourselves on some
Mhm.
of the mistakes that we made because we thought, oh, this is the right way to do it. This is the right way to do it. Then in retrospect, finding, oh my gosh, that's, counterproductive or counterintuitive to how business should actually run. And so Colin and I actually essentially had to reprogram our thought process on business strategies and take all our bad habits. And I'm not saying that we've fixed them all, but we're on the right path now.
Yeah, no, that's awesome. Yeah, I completely understand. And so with this mentorship business, that's where you learn all about like leads, how to generate leads, how to convert those leads, how to retain those leads, right? Because that's very important. And also how to ascend those leads, right? You have to, and then how you nurture those leads, right? Because
Nurture.
I do all my I I went through two marketing agencies when I was doing my thing, and now I run all my ads. I do all my social media ads. I run everything, and I understand that when I first started, I had no idea. I had a marketing agency saying getting leads for me, and they're like, "Oh, why aren't you converting the leads?" I'm like, what am I supposed to do when they send a message? Like, I don't know. Hey, you have to contact them within a minute or two, because if not, there's a 300, like Alex Ramosi says, 391% chance if that you'll get that lead if you contact within the first minute. You wait 5 minutes, I mean, that drops, right? So again, you get a lead, you're waiting to the next day to call it. The chances of those people answering, they're gone, right? But all those little nuances that you don't know, right? And it took me. I've been on this journey now from like the business, where I started my business for like 2 years, and I've learned a lot. And like a year into it, that's when well, not even a year, more than that, a year and a half into it, that's when I joined the like the mastermind and the mentorship, and a lot of like reading books, like listening to podcasts. That I learned a lot. But tell me about, so how do you what do you do to generate leads?
Since we're in an interesting space because there's B2C, which is your business to customer, and in healthcare that's usually what we talk about because patients we consider a customer at that point, right? Well, in our business model for our clinics, that's really how we work with that. But more importantly is how our education system works is because we're working with other clinicians. So yeah, they become our customers, but it's essentially a business to business, almost a
Yeah.
B2B. And so we had to formulate strategies on social media, email blast campaigns, things like that, that really catered more B2B to physicians and clinicians versus the outreach to like patients. So I would say a lot of our lead generation comes from social media and from these webinars that Colin and myself do has been a good lead generator. So we created free content on webinars and we have people join those webinars. And while they join that webinar, it's also a lead generator because
Correct.
it's gathering data from all
Mhm.
these different providers. And then so during the webinar, we also do promotions of certain things. We do it in a very subtle way. We don't do it in a, hey, buy type of situation, but we do it in a way to where we're forming that know, like, and trust. We're trying to build that trust with these providers. And so our biggest lead generators are between social media, and then gathering information with these webinars, getting a massive database of emails, and then utilizing those emails as strategies depending on their background. So if they're a physical therapist, they're going to get a different funnel, right,
Correct.
than a sports medicine physician. And so those funnels go out in different directions. Once you have that funnel, then you can nurture on different directions, right? You have to find people's pain points, which I'm sure in your fellowship you learn these things. And so once you find their pain points, you really cater towards each demographic. And then once you funnel them in, then you've captured them and now you have to nurture. And so in our line of business, we know that if a physician comes to us, it's usually about a 4 to 6 month time frame to warm them
Mhm.
up because our program's not cheap, right? You can go into an orthobiologic, you can go into a clinic, you can spend $100 to $5,000, right? So $100 to $5,000 on procedures or just whatever it might be. But when you're talking about really, really, really high ticket items,
Mhm.
people take a little bit more time to warm up. So that's how we kind of work our leads through. and it's very algorithmic. We have a good team behind us. You know, we use AI strategies, and we also use a really good CRM. I think that's one of the biggest flaws that people have is they're not using a good CRM. And if people don't know what a CRM is, it's essentially a database that runs all of your demographics, your information, your leads, you know, all that kind of stuff. So we use a CRM called Zoho, and it's very intuitive and it's very in depth, and it helps us keep everything on track. So I guess that's one thing that if anybody ever asks, I say find a good CRM if you're going to be in business.
Absolutely. Yeah, we use GHL, which is another very popular one. Go high level. Can create funnels, email, all that stuff in there too. But it's funny that you mentioned that because like we know, I understand you, but a lot of physicians, a lot of medical providers, you talk to them about customer acquisition, lead generation, funnels, and they look at you like they just have no idea. I mean, it's understandable because you've never been taught that, right? But at this time where we are with social media, and it's something that is like you have to know how to do, right? Or if you have to, you pay somebody. But even if you pay somebody, because when we started our clinic 2 years ago, I was paying a company, right? But then I'm like, I want to learn how to do this. Even if I don't do it, I need to understand, right? So I came across, I have a business partner now that we have a marketing agency on the side too. And I do the business consulting from a medical provider because we own the practice and stuff like that. And he does all the back end. We created an AI software that answers all the messages within a minute. We can train the bot with all the offers that we have. So by the time they get to us, they're more of a warm lead, right? Once the person mentions they want to book an appointment, we get notified. We call the lead. We don't have to, because with meta ads and leads, and I didn't know this at the beginning, it's like a 10 to 15% conversion rate, right? They're cheap. They're very cheap leads, but again, they don't convert very well. It's like people are like squirrels, right? They're just scrolling down, they see something, they click. You don't call them within 5 minutes. They click like 10 different ads, right? So they're so again, you need that follow up is super important, right? Again, and you said like the higher the price, the harder it is. I started running ads for like regenerative procedures. I didn't know anything about marketing, right? That doesn't work. You're trying to sell a $5,000 procedure to call audience. They're like, I don't know you, I don't like you, I don't trust you, right? So that was, but again, that was a lesson that I learned over the past 2 years of like doing it. um but that's cool. So you have the CRM. Do you do any paid ads or just like from your webinars? How much you get your?
Yeah, so we tried the paid ads, you know, through social media. We tried through Instagram, but again, Instagram doesn't seem to convert as well for us
Yeah,
from a
yeah.
B2B perspective.
Hmm.
If we were shooting for like, you know, customer-based patients,
Yeah.
Instagram, Facebook, those things are great lead generators. But LinkedIn, and I'm gonna talk a little about it because I
Yeah.
think most people don't realize the power of LinkedIn. I'm not saying that I'm an influencer or I have a huge following or anything like that, but I would truly say that LinkedIn has made a significant impact on the amount of leads that we have because you're talking to other professionals, you're talking to people who are in the space, you're putting out, you know, information where people have more expectations of valid information, empirical data, evidence-based practice.
Hmm.
And when you're on Instagram, people, and again, I don't want to knock Instagram or any of the other
Yeah.
social medias, but people can, you know, there's a lot of people out there, a lot of charlatans that really don't know what they're talking about, but
Yeah.
because they have a symmetric face, nice smile, and good hand gestures, people follow them blindly. Whereas on LinkedIn, I think there's a little bit more credibility on the professionalism and
Hmm.
the medical data that we put out there. So I think LinkedIn has essentially transformed a lot of our leads that I would say, and we promote all of our webinars, we promote all of our stuff. We've tried paid ads on LinkedIn. I'll tell you right now. Sorry, everybody. Just be who you are and make
Yeah.
good content, and
Correct.
people will come to you. when we paid for things, we did not get the ROI that we anticipated. But when we put out good data, and I'll be honest with you, you have to be a little bit of a showman. You know, you have to have a little bit of entertainment with your education. Um, we found that that's been probably our biggest lead generator is on LinkedIn.
Yeah, yeah. You're talking about you have to have that hook, right? You have to hook people, right? If you're not, like you say, if you're not doing that entertaining part, you might have good information, but people might not stop to watch what you have to say, right? So you have to be able to hook them. I see a lot of your content. Um, so now, when did you, because one thing that I find a lot is people that they're burnt out, they're working the W-2, they're either a nurse practitioner, PA, primary care. These orthopedic surgeons are seeing 40, 50 patients a day. Yeah, I mean, you make good money, but when I did my sports medicine fellowship, I trained with two big orthopedic groups, and I remember when I would be with them, by the end of the day, I'm like, I don't even know who I saw. We're seeing 50 patients a day. That's a lot. On top of that, you have notes, you have, surgery days. It's a lot. People get burnt out, right? And that's why people do it for a certain amount of time, and they move into more of an administration role or whatever it is. But I know a lot of people are burnt out, and they just don't know, like, they're like, I have no idea where to even start, right? Or a lot of people, they just have the self-limiting beliefs that, oh no, well, they can do it, but I can't. I'm not smart enough. I don't know what to do. Did you ever feel like that when you like venture into like, hey, I'm burnt out, um, from being a physical therapist, seeing patients back to back, and not growing, my income not growing. I'm, just burnt out, can't provide really good quality of care because you're seeing so many patients per hour, right? And that's like what typically happens. But it's like, I had that didn't have that internal belief that you couldn't do it, but you went ahead and did it anyways.
Right. And I don't want to knock the education system, but let's be honest, is when we're in PT school, or, I work with enough physicians, even medical school, they're not trained on how to be entrepreneurs, right?
Absolutely.
We're really trained to go through the grind and do what we're told, right? And again, I'm not going to knock insurance, but we also realize that the insurance model has really limited to what we can do for patient care because we're so handcuffed to what we're allowed to do, number one. And number two is with decreased reimbursement rates every time that we look. You go on their website and we find out that this is decreased, this is decreased, this is decreased. Well, what does that force us to do? It forces us to have a volume-based practice versus a value-based practice. And so this to me leads to so much burnout because what you're finding is a decrease in care
Mm-hmm.
so you can see more people just so you can stay above water. Just so I can pay my bills, I now have to see, 20 patients, 30 patients, you see the point. And
Mm-hmm.
there's that decreasing value of patient care over time because you just can't give the amount of time, the thought process, and then your brain just goes into overdrive and then you get burned out. And so there's been plenty of times when I was W-2 worker or whatever you want to call it, there was plenty of times where at the end of the day, I said, I can't do this. And then having the time and effort for a family,
Mm-hmm.
then puts a lot of stress on it too. So, I mean, a lot of clinicians have families on top of it. So it's like that work-life balance. And then at the end of the day, you're like, all right, I just can't do this. And that's where you're right. People go to admin or go into medical sales or completely get out of the healthcare system. And I think there's ways out of it, and that limiting belief is we've been taught so much through our education and through clinical practices that this is just the way it is. And that's a bunch of crap. That is a bunch
Yeah.
of crap because that's not the way it has to be. And people like you and, our Mavericks Business Fellowship and people out there that understand that there's a way out of this. I think promoting it like this and having good communication and getting people to realize that there's a light at the end of the tunnel. I think that was one of the reasons that I wanted to come on with this podcast is because I think this is a good avenue to teach people that you're not stuck. You don't have to be burned out. you know, you can do something about it and stay in the the medical field. You can do
Mhm.
something about it and not have all those stressors that are weighing you down.
Yeah. And I know you brought up the whole family thing. That's because that's very important to me. I know we talked about this before we got on the podcast, how um, it's tough because entrepreneurship, people talk about the glamour and they talk about the freedom and the time. And I heard somebody say, it's like, yeah, I'm going to stop working 40 hours for somebody else, so I can work 100 hours for myself, right? Because it's nonstop, right? You're making, I mean, even if you have a business partner, you have a coach, at the end of the day you're making decisions, right, that are going to impact the future of income generation, your family, things like that. So there's a lot of stress too that a lot of people don't talk about when you're an entrepreneur, right? Again, you go to Instagram and everybody, "Oh, I want to be an entrepreneur, I want to do this, I want to make all this money," but that comes at a price too, because again, there's a lot of stress, a lot of sleepless nights when you're like, "Hey, I'm not, it's super slow this month, I'm not generating leads, what am I going to do? I got a bills to pay, I got a family to take care of." So it's not just that glamorous life that people put on Instagram with the Lamborghinis and Ferraris and like all parties and stuff like that. It's like, no, it's tough, right? It's hard. um and you have to understand that going into, yes, it's possible, right? And if you work hard enough, most people in the healthcare field, they're used to working hard, right? It's just like it's a different type of working hard, but you have to know that yes, you do have time freedom, yes, and that's something that, it feels good. You can't really put a price on that, right? Having that freedom where I don't have to report to someone else, like I decision on my own, but at the same time it's hard because you are doing everything, right? You're the one that, hey, I need to get more leads in, I have to convert them, I have to keep them, I have to, and as you grow, then you start hiring people and you start delegating, and it becomes a little bit easier. But still, if you're the founder, you're the CEO, at the end of the day, is you're the one that has to make the decision. I just want to, I just want to let people know that yes, it's possible. You gotta, first of all, you have to become aware. We talked about this before. You have to become aware that there's a problem, that you want better for your life, and you have to make that mindset shift, because I think that's one of the most important things that people you have to, you once you make that mindset shift that anything is possible, and then you see other people that have done it. And my thought process when I went back to medical school at 32, and I left a career, I was making six figures as a therapy, hustling, right? Hospital PRN, nursing home PRN, I was doing good, but I left all that to go back to being a broke full-time medical student in residency for 10 years, right? Um, you have to get that, it's that mindset, right? It's like, hey, this is what I want to improve my life, it's going to take time, but that mindset and the awareness, I think, is very, very important. But people have to understand too, how that is not a walk in the park. It's tough, it's going to take time. And that's why, before I forget, I wanted to mention, you have to have a strong why you're doing it, right? Because if you don't, you're gonna quit, right? And I don't know what your why is. To me, my wife is my wife, my family, my daughter, leaving a legacy for them, right? So you want to talk a little bit about that?
Oh, 100%. And we all know Simon Sinek and Find Your Why. And I think at the end of the day, my why is my family, right? My why is taking care of them. And you're 100% right. You can listen to people and you can see them on social media, and that looks like everything's golden, everything's perfect. They have everything they need because they went this route. But you're right, 100%. There's still a grind behind it, but the
Yeah.
why makes it that much easier. I'm doing this for my family. I'm doing this because I don't want to work for somebody else. There's more drive behind it. And yeah, there is sleepless nights. There's times where you're like, oh my gosh, this is too much for me. That you can still burn out, trying
Mhm.
to work for yourself easily, right? You could burn out doing W-2, you could burn out doing, independent work. But if your why is strong enough, like what you said, I think it will help carry you through a little bit better, get you through those sleepless nights, remembering that at the end of the day, you're doing this to get away from, working for somebody else and creating a legacy, like you said, creating a legacy for the family.
Yeah, I think that's very important, because again, you can go and work hard for somebody else for 20 years, 30 years and retire, have nothing to show at the end. As we're, right now we're building a practice, you were building a practice that one day, hey, my daughter wants to take over it, she can. If not, you can. The goal is we're going more now into medical aesthetics, because again, from a business standpoint, um, what I've people want it, right? It's funny because people, a lot of patients will, they don't want to pay. You talk to them, I have arthritis on my hip. Oh, well, you can do some PRPs, 1500, whatever it is. They don't want to pay. Now I'll just go to my primary care, get a steroid injection. I'm like, well, you're destroying your joint over time. Oh, but that's what the insurance covers, right? So it's tough even at this time. We have, it's like a lot of education, these patients, right? But even that way, they don't want to pay for it. But when it comes to, hey, I'll get a laser treatment, I'll get some tox in my face, they'll go without, they'll go a week without buying food, but they'll get their cosmetic treatments done. And I mean, from a business standpoint, it's a easier sell, right? But we're trying to build a practice again with the goal of we're just going to scale it, and then either we're going to exit, right? Exit, sell the company, and then or if my daughter wants to take care of it, she can take care of it, right? I have a bachelor's, I have a master's, I have an MD. I will never force my daughter to go to college. This day and age, like you don't have to go to college. I mean, unless you want to be a professional. If she wants to be a doctor, she wants to be a PA, a lawyer, that's fine. That's different though. But to go into business, like you don't really have to go to, unless you want to work corporate. But if you want to, when you're busy being an entrepreneur, you don't need that. You're going to learn more actually by doing. Hey, you turn 18, you're going to come work on the practice, you're going to learn. I heard somebody talk about back hunter and gatherer era, right? That's how people learn. They found a mentor, they found a hunter, they followed them, learn how to do things. He wasn't sitting down in a classroom reading from a notebook, right? And then answering a multiple choice questions, and you get penalized if you get it wrong. Where in real life, when you're doing out there, you make something wrong, you learn from that, you get better, right? But that's not how the way that they train you in the school system, right? It's like, oh, well, I'm scared to get it wrong because I want to get a bad grade, and then I want to be labeled as I'm not that smart, right? But again, that's why all these multi 7, 8, 9 figure entrepreneurs, they were like C students, right? And everybody talks about that, right? Because again, you learn that grind. You learn, hey, I'm just gonna go for it. If I mess up, I'm gonna learn from it. I'm gonna get better, and then not mess up again in that way and keep growing, right? Where the school system kind of penalizes you for that thinking, right? And that's where you have highly educated, like a therapist or any type of medical professional or doctor. That's your mindset since you were little, right? I have to learn this way, and I had to answer this question the right way. And then now it's like, hey, I want to start a business, and it's like, well, now you have to completely change your mindset, right? One of my mentors says, you have to have your mindset. Once you have your mindset right, the tool set and skill set you can learn. But the mindset is like the number one change you have to make, right?
Yeah, 100%.
But yeah, man. So this has been an awesome conversation. I know I've been watching your stuff. I think we reached out to each other when I was in fellowship back in 22, 23 on IG, and I had a bunch of changes in pathways. That's why I kind of started this podcast called The Shift, because I have so many shifts in my life, right? And it's been hard, right? Is you getting that mindset right to make that shift, but at the end of the day, it's worth it. I know I've seen you grow over the past, even with your content. You've gotten a content creator now the past like 2 or 3 years, right? Improvements in your content, but you understand from a business standpoint and this day and age, like creating that content is like building your brand. That's what's all about now is building that brand, that reputation, right? People, hey, when they look at your content, again, and you're warming up with those cold leads. And I tell a lot of people that I consult, I'm like, listen, yes, even if you do run ads, you don't want to sell stuff in your organic, but you want to have your organic. So if you do run ads and people look you up on your Instagram, they can see all that stuff, and you can nurture them all by all the value content that you're putting out, right? So you got to give, right? I think
Yeah.
Gary Vaynerchuk, he says it was a jab right, jab right hook, right? So give, and then ask, right? And a lot of people you throw, and then that's why people don't like salespeople, right? Because they feel like a lot of salespeople are pushy, right? My mentor says it's like sale is basically is not it's persuasion. It's just basically letting people know how much value you have, and they make that if they can see how much value you have to offer to help them in their transformation, then they'll be more than willing to like give you money to help them get there, right? So you just got all you have to do is you don't have to sell them anything. You have to provide value, demonstrate how much you know, and that you want to help them, and people will be willing to pay you if they like with you with the content that you put good content out there. Somebody's looking to learn ultrasound that doesn't know. It's like, oh, Ryan is a cool guy. He has really good knowledge, good information. I'll pay him to teach me, right? But you're not really out there like, oh, you have to buy my program. Oh, you have to buy my program, right? And it's a lot less
No.
stress too. It's a lot less stress, anxiety that you don't have to worry about. Like, listen, I'm going to do my best. I'm going to put good content out there. I'm going to teach people, provide value, and people are going to find me, right?
Yeah, I find that to be, yeah, that's very true. I, when I do my, social media, social proof is powerful, such a powerful media because, I go out there and I just be myself,
Yeah.
and I show people what I know and how you can do it. And you're right. Just like Gary Vee says, is I give away. I mean, if you follow my LinkedIn, you're going to get so much free information. It's unbelievable.
Yeah. Yeah. But that's how you got to do it, right? Because again, you provide value. I mean, that's all you can do. Provide value, show people you care, that you're knowledgeable, and you just put yourself out there. People that need you are going to find you, right? You don't have to go out there and that's why, like I said, back to the whole people that pressure. People think about sales, a salesperson think about pressure, and they have this negative connotation with sales, right? But again, if you're not trying to push your thing on anybody, you're just providing value. Hey, this is my content. This is what I do. I help people with this, right? I help medical professionals try to get out of that mindset of that W-2, and that they can take control of their life, their financing, their purpose. Getting through that mindset block, that self-limiting beliefs. Like, listen, you know, there's millions of people out there that do it. Why can't you do it? You can't. You just got to get your mindset right, right? It's not going to be easy, but again, you have your mindset right. You become aware that you want change, and you also have a strong why, and then you can do anything.
100%.
Yeah.
100%.
All right. Well, this has been a very good conversation. So, how can people connect with you? Do you have any IG handle,
Well,
email that you want to drop?
yeah, well, realistically, LinkedIn, just type in my name, Ryan Martin, on LinkedIn, and that's probably the best way. I mean, you can go to Instagram. I don't post as much through there, but realistically, LinkedIn is really the best place to find me.
Okay. All right. I know where you're at. I've seen a lot of your content. It's really good. I keep following you. So this has been a great conversation, man. And I'm glad that you agreed to be on the podcast. And hopefully we can get our both of your name and my name out there, and we can just keep providing value and helping people.
Well, I just wanted to say thank you so much for having me on your show. We've known each other for a little bit of time now, actually quite a bit of time now, and to see you grow, as much as you have in the past couple of years has been amazing to watch as well. So,
Oh,
thank you so much for having me on your show.
all right. Welcome. We'll see you. Bye bye.